Closing the gap is actually closing the gap in a range of ways. It can be closing the gap in life expectancy, which we know is 12.7 years if we look at it from a public health perspective. The actual life gap in between children and young children is also quite wide, but we want to see that coming closer in the margin of health expectation for a child being born today of Aboriginal and Torres Strait Islander descent being very much aligned with the child being born of non-Aboriginal and Torres Strait Islander heritage. It's making sure that there are initiatives that we can improve the connection between Woorabinda and Rockhampton so they don't seem like two different places. We can start to streamline and integrate, if you like, some of our services. It's starting to improve the way in which we promote the positives, all the good news stories that are coming out. We're starting to see that with the drift. We're seeing more stories being shared about the positive events that are happening across the community, about, it's responding to the interest and curiosity of our wider staff about what our Aboriginal and Torres Strait Islander health services do. So that's one of my priorities, is to improve the siloing so that it's more integrated. So we don't want to silo something, we want to make sure that Aboriginal and Torres Strait Islander health is everyone's business. But to close the gap for the hospital and health service is also to work in partnership with other agencies who have a responsibility to ensure that education, employment, training, housing, those types of community control of their health services, community control of their education and training opportunities. The more that we enable Aboriginal and Torres Strait Islander people to take control of their healthcare and all other parts of their social and economic wellbeing, we'll see us begin to bridge that gap and not have it widen.